Hello everyone, welcome back. My name is Dr. Vijay Bhatia. I work in the mental health. Today we are going to talk about what is anorexia, especially just anorexia nervosa. Anorexia nervosa is a disorder characterized by deliberate weight loss, induced and sustained by the patient. So the important words here is deliberate. That means self-induced. Person wants to lose weight. Person wants to set a target for his or her weight to a standard where they want to maintain at that weight. And this is induced deliberately, personally, purposely, intentionally to keep the weight low, and not only to keep on decreasing the weight, but to sustain the weight low deliberately, intentionally by the person we call here as a patient, because the weight is too low for the normal healthy survival. It occurs most commonly in adolescent girls and young women, normally from the age of 12 or from puberty to under 20 years old. And the boys can also be affected, young boys, but the ratio, it is much more common in women and girls than young men and adolescent boys. And it can happen in children approaching the puberty. But it can also happen in women who are coming up to the menopause round about age 50 to 55, or sometimes even slightly earlier. The disorder is associated with a specific psychopathology. Psychopathology means psychic means brain or mind. Something is wrong in the mind. Pathology is when there is some change from the normal. So there is thinking behind it in the mind that is different, that is changed for whatever reasons, either cultural reasons, pressure from the media, pressure from the peers, or even getting the feeling from within. And the person dread of fatness, there is a feeling of dread, as if extreme worry that they are going to get fat, and they have this feeling that flabbiness of the body contour will persist if they don't lose the weight, don't lose the fat by excessively restricting their diet or exercising or whatever other means. They have this awful feeling inside, and it is so fixed, so firm, no matter how much explanation they get from the doctors, from the family, that their bones will be thin, their skin will be wrinkly, or they will get dehydration. They don't care. They're only worried about fat and flabbiness, and they have this extreme fear, and they want to avoid that fat being built up on their body. And it is intrusive. Even if they want to stop these thoughts, they can't. They keep on coming to their mind from inside, and they can't help it to stop it. It is as if they have lost control over these thoughts, and they are preoccupied by these ideas. We call these as overvalued ideas and not as delusions, because it might be in the culture they live in, or the society or the family they were brought up in. There is a feeling that thin and curved body contours are the norm for that society. So it is not an thought or idea that is coming out of the blue, being inserted into them from outside forces, but it is more like a cultural thing, and therefore it is an overvalued idea. But the person get very distressed from these ideas, therefore they act on it, and therefore they want to lose the weight and keep the weight low. And the patient impose a low weight, which is very low threshold compared to their normal peers of their age, of their similar, if it is a male with a similar height and weight to the normal people, their threshold is very low. And what happens? They usually don't eat anything, or don't eat much, or eat only few things. They calculate the calories, they calculate the fat content, they calculate the carbohydrate content. So there is usually undernutrition of varying severity. When we say undernutrition, it's not only with the calories or fat or carbohydrates. They lack in even vitamins, minerals. They are not eating healthy food. And as a result, there might be problems with their hormones, endocrine system. And these hormones can be anything from the sex hormones, or from the pancreas, or cortisol, and number of other hormones, and even thyroid hormones can be affected. And if it is a metabolic, like changes in the blood glucose and fat content, they can cause metabolic changes. Even salts, sodium, potassium, they can be lowered or increased because of the dehydration, because of the concentration of the blood, and not drinking enough water, not eating right amount of food, and on top of that, sometimes vomiting too much, or taking some other drugs that they shouldn't be taking to suppress their appetite, or using diuretics to keep on passing water in order to lose the weight. That will cause endocrine dysfunctions to the extent that it can be damaging to the body, that bones will become thin, skin will be really thin and easily able to bleed, and bones are sticking out, and they are easily break as well. There might be constipation, there might be number of other factors. They may not have regular periods, and in men there might be problems with their sexual performance or potency, or even losing interest completely. And all these can affect disturbance in the bodily function. The symptoms include, as we said, it is a restricted diet choice, very low calories, very low carbohydrate, very low fat content, and even minerals and other salts and fiber. They're very, very careful what they eat, when they eat, how much they eat. And if after whatever, even if the amount is normally very, very small, and they don't binge eat, that is the difference between bulimia nervosa, where they sometimes binge eat, but in anorexia nervosa, normally the persistent pattern is that they will eat very, very low food, and their weight is very less. And they keep on having excessive exercise, going to the gym, running marathons, miles and miles, and doing dynamic exercises, and even sometimes hiring the personal trainers to help them keep on losing their weight. And if that doesn't help, or even if it helps, and despite that, even though the weight is still less, still they induce vomiting. They will put fingers in their mouth, or eat some drugs which are known to cause vomiting. And sometimes you can feel their teeth, they have a slight erosions because of the vomiting, the acid coming from the stomach affecting the teeth, and the teeth are eroded in some places. They are more prone to caries, and you can see the signs on their hands and fingers when they keep on putting in their mouth deep in the throat, and in the process they hurt their fingers, and scars are on the back of the hands. Or they use purgation sometimes to like things like lactulose, or where they will keep on having bulk producing stool, so that they developed some kind of diarrhea. When they eat, the food passes quickly out of the system. And sometimes they use appetite suppressants, which can be available locally from the pharmacy, or sometimes they use herbal or from health shops, which are appetite suppressants. They are known for this. And sometimes using diuretics, which makes you pass more urine, take the water out of the body. However, during this process, when diuretics, the way diuretics work, a lot of salts are excreted from the urine, and therefore there will be imbalance of salts in the blood, therefore causing disturbance inside and feeling weak, tired. Despite that, they don't stop. They keep on doing these things as if they have to do it, and as if they don't have any control over it, and the feeling is very dreadful of gaining weight. So what is the criteria? There is weight loss, we understood that, and in children, if the weight is the person does not, if the child does not gain weight, especially around the age of puberty, they are supposed to be gaining weight as they are growing up, and if they are not gaining weight, and it will lead to the body weight, which is normally at least less than 15% below the normal or expected weight for age and height. So that will be the first criteria, that the weight is less and it is compared to the normal people at that age with their normal height. Their BMI will be less, at least 15% below the normal. And another important thing is the weight is self-induced by either avoidance of fattening foods, carbohydrates or other foods, and there is this self-perception. They look at themselves that they are too fat, and they have this intrusive dread of fatness. That means extreme worry, extreme feeling that they are very fat despite being very thin and very fragile, which leads to self-imposed low weight threshold. A widespread endocrine disorder involving the hypothalamic pituitary gonadal axis. So there is a hypothalamus in the brain, and it leads to the pituitary gland within the brain, which secretes the hormones which supplies the gonads. That will be stopped. So follicle stimulating hormone is telling the pituitary to secrete the hormones to supply the ovaries and testes to produce the sperms and egg cells. But because of the disturbance of this, the person will not have that. There might be low prolactin, low oxytocin, and number of other hormones may be affected. And in women, as a result of this hypothalamic pituitary gonadal axis, the woman may not have any periods. They may develop amenorrhea, so they are not having periods for months and months, and is manifest in men as the loss of sexual interest, and even the potency is lost. An exception is the persistence of vaginal bleeding in anorexic women who are on replacement hormonal therapy, most commonly taking as contraceptive pill. So they will continue to have vaginal bleeding and because of the contraceptive pill. Thanks for watching. If you like this video, please press the like button, share with your friends and subscribe the channel. There are more videos on the mental disorders, and in this series on eating disorders, the next is going to be on bulimia. Thank you. I'll see you again.